this slide. 928,741 people in the United States died of cardiovascular disease in 2021. That's like 1 million people dying of cardiovascular disease in 2021. That's a lot of people. And if we break down more precisely the cause of their death, we get all these categories here on the left. Coronary heart disease, atherosclerosis. But stroke also usually the consequence of atherosclerosis. This sort of other category includes some degree of atherosclerosis, as does heart failure. And so if you add up all of these percentages, it's like 65% of cardiovascular disease deaths are the consequence of this one process, the development of atherosclerotic disease, whether in the coronary arteries or in the carotid arteries or elsewhere in the peripheral vascular system. The thing is, not everybody develops atherosclerosis to a degree that it would be clinically significant, clinically relevant, and others do. There is a big genetic factor determining who develops coronary heart disease or peripheral vascular disease and who doesn't. And so it's, some people are just in the lucky DNA club and don't get it. But enough people get it that cardiovascular disease kills 21% of us. So it's worth paying attention to. As we get older, we should do what we can to mitigate risk, that's for sure. Hypertension is considered an element of cardiovascular disease, and it is a major risk for the development of atherosclerosis. So some of these causes, like here it says hypertension is a cause for 13.4% of deaths. Hypertension contributes to coronary heart disease, it contributes to stroke, it contributes to the development of atherosclerosis and heart failure. And so, one of the main things I want to talk about in this video is how does the autonomic nervous system affect the likelihood that you're going to develop atherosclerotic vascular disease, whether it's in the coronary arteries or anywhere else in the body. It's serious, and you should pay attention to it. And we know this is true because we often talk about our nutrition in terms of how heart healthy it is. What fats are we supposed to eat? What fats are we not supposed to eat? A heart healthy diet in terms of, eating lots of vegetables and less saturated fats. And, with respect to the latter, it seems like we're learning maybe we were a little bit off track on whether saturated fats are really as unhealthy as we once thought they were. And then a lot of people now think seed oils are really a major culprit in terms of screwing up our metabolism and making us vulnerable to cardiovascular disease. I think we'll continue to learn more about it. The number one factor sort of determining our cardiovascular health beyond what we eat is just whether we tend to be in the overfed state or if we tend to be slightly underfed. It seems like not eating as much, not eating as often is directly associated with longevity. And eating too much and too often seems to be associated with a shorter lifespan. And so that's something to consider as well. But the balance of your autonomic nervous system, how well your sympathetic and parasympathetic nervous system is working when you're at rest, really has a lot to do with whether or not you develop clinically significant atherosclerotic vascular disease. Are you ready? Atherosclerosis. Sometimes we used to say hardening of the arteries, because actually atherosclerosis is associated with deposits of calcium building up actually inside the wall of our arteries in our heart. And the arteries, if you were to take them out of the body and hold them, feel hard. They are turning into stone in essence because of these calcium deposits. But it is this disease process, atherosclerosis, that is directly related to autonomic dysfunction. Now, doesn't that make you curious to know how well your autonomic nervous system is working? How is it performing? How is it accommodating the demands of your life and environment? And how is it working when you're at rest? That latter one is really what determines how vulnerable you are to developing atherosclerotic heart disease. Isn't that exciting? 5 ways the autonomic nervous system is trying to kill you. The first one is really interesting to me. We have talked about stress ad nauseum. And we're often advised to reduce stress. And it turns out that's pretty good advice. But what do we actually mean when we say reduce stress? We have a built-in response to stress within our autonomic nervous system, whereby the sympathetic nervous system becomes more dominant. It increases heart rate and blood pressure. If chronic, can lead to development of atherosclerotic coronary heart disease. Now, the stress response in the short term, if you're being chased, if you're threatened, in danger, can be adaptive and very useful. But it's the chronic state of having too much sympathetic input that can be dangerous. And it is also uncomfortable, right? We don't like the feeling of having chronic sympathetic overload. It's almost a philosophical question, is stress the response to an environment that becomes chronic hypersympathetic, or is stress our recognition of the feeling that state gives us, the feeling associated with increased circulating adrenaline, or a group of adrenaline-like chemicals called catecholamines? And the answer is probably it's both. Our native response, which may be programmed to a degree by genetics, it may be lifestyle related, but it's also the experience of being in that sympathetic state that we find uncomfortable. And that can lead to bad behaviors. We'll talk a little more about that, and also hemodynamics associated with autonomic imbalance, the inflammation in our bodies that can occur when we're in autonomic imbalance. Even metabolism is hugely influenced by the state of our autonomic nervous system. Endothelial dysfunction is not something you think about every day, but boy, it's so interesting and important. The cells that line the inside of our blood vessels, especially small and medium-sized arteries, those cells, this thin layer of cells on the inside of those vessels, act like an organ. They secrete all kinds of messengers that have an effect on how constricted those blood vessels are, how high your blood pressure is, how likely a clot is to form within those blood vessels, a lot of things. And that endothelial function is affected by the autonomic nervous system. And finally, a metric that's getting kind of popular lately, heart rate variability measurement, which you can remarkably determine for yourself with a wearable like an Apple Watch or something like that, is highly correlated with your risk of developing a cardiovascular event like a stroke or a heart attack. And so it's something that you can actually track and then alter behavior in a way that favorably impacts heart rate variability. When we're in a chronic stressed state, chronically hypersympathetic, heart rate variability goes down. And you can measure it and see where you are on that scale and then do things to adjust that more favorably. That's pretty cool. This is a new way of thinking about your health and well-being, right? Upstream from the traditional way of thinking about our physical health, in particular our fitness. This is really more at the core of the mechanisms that lead to our most likely cause of death. So it's worth paying attention to. With respect to the thing called chronic stress, right? This long-term elevation in sympathetic tone while at rest, not while responding to an immediate physical or emotional threat, but being too sympathetic even when those threats don't exist, right? That's the thing we're referring to as a chronic stress. And as we just discussed, it's uncomfortable. It doesn't feel good. It makes us feel anxious, right? Anxiety is a big problem in our very complex society, where I would submit we live in a very unnatural way, right? Having access to all information everywhere we go at all times is overwhelming, right? And a lot of us don't respond favorably to that, and it creates a sort of smoldering, elevated sympathetic state we call chronic stress, and it's not good for us. And it's uncomfortable, and we'll often say, I don't feel good, I feel anxious. And we will often respond to that in a way some people refer to as self-medicating, or doing things that are unhealthy because it helps us calm down. right? Smokers find the nicotine contained in tobacco products to be very soothing and calming, and so much so that they would say, well, it even helps me focus because I'm less distracted by the anxiety that has become my baseline state. People vape now for the same effect, right? That's just a way of delivering nicotine to the body, which makes people feel good. They like it, they do it, but it is a chemical and a drug that does, in some people, really dramatically increase their blood pressure. That's probably not something you want to do, especially if you're already hypertensive or if you already have risk factors for coronary heart disease and you're using a vape all the time. You're probably creating a chronic hypertensive state that is not going to be good for your vascular health. And yet it helps people that are feeling anxious because it's their autonomic nervous system that's out of balance. And what about alcohol and drugs? Well, it's the same thing. Alcohol works like a charm, right? And so quickly, if people are feeling anxious, chronically stressed, chronically hypersympathetic, use of alcohol or drugs can ameliorate that feeling. But the secondary effects of chronic use of these chemicals, of these, to a greater or lesser extent, toxic chemicals, has an impact on the body that we don't want, right? There's got to be another way, a healthier way that is not damaging to the body. What about overeating? Can anybody relate to this? People, what's the expression? They say, people eat their feelings. Well, it's kind of true for a lot of people that don't smoke or don't drink or don't take drugs. But you know what? When they're feeling anxious, they can soothe themselves by over-consuming and consuming things that may not be the healthiest thing, especially carbohydrates, right? It's another form of self-medicating that we do as a consequence of feeling not at ease because we're in a chronic hypersympathetic state. So overeating is another behavior. And I mentioned this earlier, but I think more important than whether we're in a keto or a carnivore or vegan or whatever kind of diet is being touted as the only way to go if you care about your health. I think there's a bigger picture, and that is, are we overfed or are we not overfed? Even what we're choosing to eat, right? Lots of people make unhealthy choices about what they consume, but it is the frequency with which we eat and the total number of calories that we're taking in that determines the oxidative stress our body experiences that can be damaging and destructive and have secondary effects in terms of our metabolism, which has an effect in terms of inflammation, which has an effect in terms of development of disease states like atherosclerotic coronary heart disease, peripheral vascular disease, right? Myocardial infarction and stroke are the consequence of those disease states that we should try and avoid because they kill most people. It's the most likely cause of death. And then even not being able to sleep properly, I don't think that gets enough consideration. It has a lot to do with our health and well-being, and like metabolism, right, has secondary effects in terms of blood pressure and insulin resistance and weight gain, and also our ability to cope with the uncomfortable feeling of being chronically hypersympathetic, of being in a chronically stressed state, this thing we call anxiety for a lot of people. So sleep hygiene really plays a big role, and this kind of falls within the category of things that we can adjust to improve our autonomic state, right? To improve the thing that's creating this dis-ease, this discomfort that we're accommodating through bad behavior, right? And we all do it. So we ought not beat ourselves up about it, but we should see it for what it is. And with that understanding, I think we are well fortified and likely to be able to make better choices.